This ESPN podcast is brought to you by Geico. 15 minutes could save you 15% or more on car insurance. Visit geico.com.
The following program is a paid advertisement. The views reflected on this show are not necessarily the views of ESPN1000.
Doctor? 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 Doctor?
Doctor?
Doctor?
Doctor?
You're listening to Sports Medicine Weekly with Steve Kashul and Dr. Brian Cole on ESPN 1000.
Sports Medicine Weekly being brought to you by Midwest Associates, the number one choice for advanced orthopedic solutions, innovative products, and superior customer service. By Accelerated Rehabilitation Centers, putting patients first. By Theratech Equipment, a winning team for fast and complete recovery. By Midtown Athletic Club Oak Park, your place for small group fitness and sports performance training. And by Midwest Orthopedics at Rush, team physicians of the Chicago Bulls, White Sox, and DePaul University Athletics. Good morning, everyone. Welcome to Sports Medicine Weekly. My name is Steve Kashul, radio host of the Chicago Bulls. Soon I'll be joined by my co-host, Dr. Brian Cole, the head team physician for the Chicago Bulls and sports medicine specialist from Midwest Orthopedics at Rush and Rush University Medical Center. Thanks for joining us. We come your way each and every Saturday morning at 8:30, helping you with your sports medicine injuries and all the hot topics going on in sports medicine. So stay with us. Back to get it going right after this on ESPN Radio.
The Chicago Bulls, White Sox, and DePaul Blue Demons rely on Midwest Orthopedics at Rush for advanced orthopedic treatment. So can you. We are the team physicians for these Chicago teams, and we're ready to be on your healthcare team too. Get expert care from these regional leaders at 4 Chicagoland locations. Learn more at rushortho.com. Midwest Orthopedics at Rush, your world-class team physicians. Do you face orthopedic surgery for a sports or work-related injury? Theratech Equipment is Chicagoland's trusted leader in providing continuous passive motion for home use. Theratech will demonstrate how you can have a speedier, less painful recovery using a CPM device delivered right to your home. Theratech Equipment, your winning team for fast, complete recovery. Visit homecpm.com.
You're listening to Sports Medicine Weekly on ESPN 1000.
Back here on this Saturday morning, Steve Kashul with Dr. Brian Cole. Dr. Cole, of course, the Bulls team physician and from Midwest Orthopedics at Rush. And net proceeds from this show, Sports Medicine Weekly, go to support orthopedic research at Rush through the liveactivenow.org fund. Always talking about the latest in medical technology. And Dr. Cole, let's talk a little bit about knee braces. And I've got a couple questions for you, but first of all, notice that Joakim Noah, coming off the knee surgery in the summer, is wearing a knee brace. And I always wanted to ask you, are they kind of off the shelf, one size fits all? I mean, obviously he's a 6'11", 7-foot player, but for your typical patients, or are they custom made?
It depends on the reason the brace is prescribed. There's certainly a number of braces that can be off the shelf. They're very cost effective. That combine compression, they may offer some stability. Inner linemen in the NFL, there's some data that shows that certain off-the-shelf hinge knee braces can prevent ligament injuries in inner linemen. That has really good data to support that. So you not infrequently will see that. But we use a fair number of sort of custom braces for special situations, like returning someone back with after an ACL reconstruction. There are custom ACL braces, or even getting someone back who doesn't have an ACL, who wants to sort of get a little bit more time out of their joint in a sport. Maybe they're in the playoffs. There's certain situations where you could actually get by with a custom brace when you don't have an ACL. Or probably the most common reason we do a custom is for an unloader brace, where someone has arthritis, where you can, because you want them to be comfortable, and there's no way you can find one brace that fits everyone.
And what does that mean, unloader brace?
Well, so lots of people who have arthritis are either very knock-kneed or very bow-legged, right?
Okay.
And arthritis pain is really due to load. In other words, people who have arthritis sitting in a chair typically don't have that much pain. Maybe they have achiness, but then they stand up and they walk on level ground.
And that's
they hurt
the load.
A bit more. They walk up and down stairs. They carry a load of laundry or their grandkids or whatever up and down stairs, and the pain escalates based upon the load. So it's really all about load, and it has to do with, it's not just the cartilage that's lost, it's the bone underneath there, the cartilage that's lost, that doesn't like being loaded. So things change over time. They get bone spurs and things like that. So people really never think about it that way, but really most of arthritic pain is based on load and not all these other sort of variables that we think about.
And one company out there, Oser, who we've talked about in the past, makes a couple of different knee braces, right? And they do a custom one as well.
They do. Yeah, they have a brace where we can take a couple of measurements, and it prevents slippage. These are really dependent upon a close fit without sliding and for comfort, and it's very tough to get off the shelf, so they do one that actually is custom.
Well, let's bring on a gentleman that is a retired high school principal. He has osteoarthritis in his knee and wears unloader knee bracing to stay active. This is Ken Robke joining us from Boulder, Colorado. And I want to ask you, Ken, thanks so much for joining us here on Sports Medicine Weekly. I know you wear what is it's called the CTI OA, the Oser knee brace, and then the unloader that Dr. Cole was talking about as well. How did you initially manage your early ligament injuries?
Well, excuse me, typical of ligament injuries, I did a lot of stretching and strengthening exercises and used a lot of ice and heat, and though that seemed to help me out for the most part, particularly doing quad exercises, hamstring exercises, but eventually that didn't continue to help me out, and the pain and the swelling continued, and so I began to seek out other options.
So how do you wear it?
Excuse me?
How did you wear it all the time? Do you wear it just when you're doing
No,
certain...
I wear it during certain activities. So I do a lot of extreme kinds of sports. So we wakeboard and we ski, the blacks and the bumps, those kinds of things, and in the trees. And we also surf and wake skate and do those kinds of things. So for the more extreme sports and for the high-impact sports, I wear the CTI OA brace. And the particular brace that Oser made for me has a 4% camber on it. So it acts as an unloader, and it keeps my knee stable, and it also keeps the impact at a minimum. And I use the Unloader 1, the single-arm brace, for less impact kinds of activities. So when we hike in the mountains in Colorado, we do a lot of 13ers and 14ers. When we hike in the mountains and play golf or do snowshoeing, those kinds of things, I use the Unloader, and that seems to really be helpful, and they're both very comfortable.
Were you told to have a knee replacement?
Well, I'm told at some point in time I'm going to have a knee replacement, but I really don't want to do that right now. That seems like an untenable option at this point in time.
Mm-hmm. Visiting with Ken Robke from Boulder, Colorado, retired high school principal who has osteoarthritis in his knee and wears the unloader knee bracing to stay active. And that's kind of the topic of our segment here on Sports Medicine Weekly. And a very action guy taking part in surfing, skiing, hiking, golfing, wake surfing, and also boot camps. And when did you decide that the unloader knee brace was your next course of treatment? What was the pain like before the bracing, Ken?
Well, I really had a lot of stiffness, and my knee began to swell, and it was really kind of an interesting thing. My wife had some foot surgery, and we went to Cornerstone Orthopedics, and there I saw our former team doctor at the high school where I was principal, and I connected with him, and I said, hey, I want you to take a look at my knee. He x-rayed my knee, and he said, I've got some good news and bad news. The good news is your knee is really stable, and the bad news is that you have osteoarthritis. And so he said that he could give me some injections of Orthovisc, and then from there he said, I want to hook you up with some people that would it would really help you if you had these braces. And that's how I eventually got into and made the decision to get the Oser braces. And kind of the stars all aligned. I met the people from Oser, and so goes the story.
Yeah, they make a great product. Hey, let me ask you, Ken, how do you differentiate between wearing the CTI OA brace and then the Unloader 1 brace?
Well, the CTI brace, as I said before, is if I use those during the CTI during high-impact things. So if I'm wakeboarding and going wake to wake and doing different kinds of tricks in which there's a lot of impact on my knee, or skiing in the bumps where there's, again, a lot of impact, a lot of jumping, those kinds of things, I use the CTI brace, and it gives the stability for me, where the Unloader 1 is just a much more comfortable, or a different kind of brace that gives, I wouldn't say it's much more comfortable, but it's just a different kind of brace that is much more suited for walking, golf, those kinds of things, hiking, and it's not quite as stiff as the other braces, the CTI brace.
And Dr. Cole, braces very common with what you do. I mean, talk about the post-op, following surgeries and everything. Does everyone wear a knee brace, or are there different cases, and how do you differentiate that?
Well, yeah, I mean, there's kind of two categories. There's functional braces, which is what he uses, and then there's post-op braces. We use post-op braces, which are, kind of those with Velcro that have side struts to help protect and quiet down the joint after surgery. It's almost like wearing a splint on the arm after shoulder surgery to keep it quiet so it's not so uncomfortable, reduce the inflammation, and be able to initiate some early exercise. What he has is a functional brace, which is a whole different category, and it basically is designed around people who are trying to regain or maintain function. So they have to be very form-fitting, and they apply pressure across the joint to do something, either to prevent instability. So if you have an ACL tear, you can wear a brace to prevent the tibia or the shin bone from moving forward abruptly. Similarly, you do the same thing for osteoarthritis. You can push the lower leg in one direction relative to the upper leg, so the area that you have arthritis gets unloaded with it. So I've done a lot of research in braces. We've done some gait studies showing that the braces actually can do that, reduce the moments on the inner side of the knee if you're bow-legged. We've done some design issues for braces to be used post-operatively with that same purpose. So it's been a big interest of mine. And, if anything you can do to keep someone out of surgery or help improve a surgical outcome that isn't that expensive and it is tolerated is a great thing.
That's pretty neat that they can do, again, the custom knee braces. Össur captures raw data from in a 3D form surrogate actually to create the custom knee brace. Yeah. It's not a hard measurement, is it? No, and it's very objective and it's meaningful, and it leads, and it's like getting clothes tailored. I mean, they can manage. If it's not perfect, they can make small changes. Fantastic. Well, Ken, we really appreciate you lending your expertise. Always good to find out about new technology, and I know that the Össur braces have really helped you, so it's good to hear that they're out there.
It's a great opportunity to talk with you gentlemen.
Appreciate it. That's Ken Robke from Boulder, Colorado, talking a little bit about the latest in medical technology and custom knee braces. I'm Steve Kashul with Dr. Brian Cole. More of Sports Medicine Weekly after this.
On ESPN Radio.
Sprain your ankle playing basketball? Back pain keeping you up at night? Suffered an injury on the job? At Accelerated Physical Therapy, we can help. We are a Chicago-based physical therapy company that specializes in post-surgical ailments, workers' compensation rehab, and regular old aches and pains. We are committed to returning our patients to better health and dedicated to providing the best patient experience possible. For more information or to schedule a free injury screen with an Accelerated Physical Therapist, contact 800-474-8300 or visit acceleratedrehab.com. Free injury screen not for federally funded payers. Feeling tired, sluggish, and overweight? If you're looking to lose weight and gain energy, join us in Karen Malkin's 14-day Transformation Fall Cleanse. You're going to absolutely love this Whole Foods cleanse. You'll feel great, lose weight, build lean muscle, improve sleep, boost metabolism, and enhance athletic performance. This VIP done-for-you cleanse comes with a 14-day Transformation Wellness Bag containing MCT Lean Vegan Protein Blend, fat-burning MCT Lean MCT Oil, snacks, superfoods, recipes, guidelines, videos, and other surprises. You will absolutely love this program. Sign up at 14daytransformation.com. That's the numbers 14daytransformation.com, or visit Karen's website at KarenMalkin.com. That's KarenMalkin.com. This pre-holiday cleanse starts any Monday of your choice through December 10th. Integrated Orthopedics is Chicagoland and Northwest Indiana's premier provider of thermal and compression therapy devices for people recovering from sports-related injuries or orthopedic surgical procedures. To learn more about the benefits of thermal and compression therapy and to determine if it's right for you, please contact your healthcare professional. For further information about Integrated Orthopedics products and services, please contact us at 773-248-6400. That's 773-248-6400.
You're listening to Sports Medicine Weekly on ESPN 1000.
Our website is sportsmedicineweekly.com. You can visit our new blog at sportsmedicineweekly.com to access prior shows. We've got interviews on there and other valuable content. I'm Steve Kashul with Dr. Brian Cole at Sports Medicine Weekly, coming your way each and every Saturday morning here on ESPN 1000 in Chicago and the great Midwest. And net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the LiveActiveNow.org fund. Time to talk about some winter sports. How about skiing and snowboarding? I have never gone snowboarding. I haven't skied in a long time, Dr. Cole, but you are a frequent skier when you get out of town. How often do you go?
I'm reluctant to share that publicly.
Okay,
but,
you're a busy guy.
I'll say this as much as I can.
You sneak out for a weekend here or there, maybe a week during the holidays?
we'll try to go, I'll go for 2 days even if I can. And I've kind of given up on the Midwest, so I've been fortunate enough to be able to. Utah is sort of my chosen place, mainly because it's easy to get in and out of, and I can't afford to be delayed and snowed out. So Salt Lake City is a great airport to fly into, and there's plenty of options. But I've been skiing since I've been in second grade. So we started all our kids very early, and they don't snowboard intentionally just because we kept them alpine skiing so that they never really gravitated towards, because that's where most of the injuries that I see now are happening for younger people, or
on snowboarding,
or snowboarders colliding with skiers. So we the most common thing I see are ACL injuries in skiers, but I see a lot of collision injuries and some newer things that we used to not see before with snowboarders. So we tried to snowboard 2 years ago. I took Ethan, my now 16-year-old, and
you tried it.
It was hard. I spent more time on my butt than
enjoyable,
than I did.
or
I thought it was, when I could get up and go, it was good. But skiing has become so easy and natural for me that it's like golf for me. That level of frustration was not conducive to staying at it, to be honest. But it's a beautiful sport to watch, and I wish I could do it. But I'm so entrenched in skiing now, and mogul skiing and powder and everything else, that I think it's just too late for me.
Well, our next guest is going to talk about the most common ski and snowboarding injuries. Let's welcome in Maria Kronk from Accelerated Rehab. She is an area manager with the Oak Park River Forest facility, location in River Forest, Illinois. And some of the common ski and snowboard injuries. Maria, thanks for joining us on this Saturday morning. What are you seeing at Accelerated?
Yeah, Dr. Cole kind of touched on that already. Definitely ACLs, MCLs, and meniscus and skiers. So much more lower body, knee-related injuries. And then in our snowboarders can see some head injuries. It's very easy to catch your back edge when you're snowboarding and land right on your head. So very important to wear a helmet to prevent that as much as possible. But then your wrist fractures, shoulder dislocations. So see some more upper body injuries in snowboarders and the lower body injuries in the skiers. You
guys pretty popular and busy at Accelerated with the ski injuries?
Not quite yet, but later in the year we will. So definitely as the season goes along, and hopefully out west we'll get a lot of snow. So we'll everybody will be able to get out and have some good fun, and hopefully not too many injuries, but that's when they'll start to come in.
Are you guys doing a prevention program or a preparation program?
Well, not a formal preparation program. We have our ACL 3P program.
Right.
So that's preventative, and then also after surgery, and then going post-op. So, but nothing formal or preventative.
Do you ski or board?
Both.
You do? What's your preference?
Ski, because I'm better at it.
Yeah, right. So you know what I was saying.
Yeah. It's just more fun to have all those days out west and try to ski, but then I snowboard in the Midwest.
And what do you do anything special to prepare for skiing?
Yeah, I think it's super important about 4 to 6 weeks before you're planning on going out that you prepare. So I think that'll help prevent as many injuries as possible. So I think staying up on any sort of cardio program, with bursts of like high intensity, because when you're out west and if you're going to ski or snowboard fast, those runs can be really fast. You can easily get down in 4 to 6 minutes, depending on how good you are.
Right.
So making sure that you're staying really cardiovascularly prepared, and then obviously doing lots of leg work, core type of work. So I do a ton of squats and lunges and planks and all sorts of things that'll challenge your balance. So any sort of like single leg activities, incorporating your upper extremity movements with it, dumbbells. So I try to do as many free weights as possible and keep it super dynamic.
Maria Kronk is our guest from Accelerated Rehab. This is Sports Medicine Weekly. I'm Steve Kashul with Dr. Brian Cole. Maria, what about is there such thing as a good warm-up, like the day of skiing or snowboarding? Anything you suggest? I mean, I doubt people do it, but do you guys ever suggest anything like that?
Well, I mean, I think it's a good idea to do some stretching, dynamic stretching, or just take it easy on the first few runs. It's very easy on a really nice powder day to want to go, super, super fast and do as many runs as possible. But I think it's important, just like with any other sport, that you do some sort of warm-up. Make sure your muscles are nice and loose and warm before you really spend the rest of the day outside.
Dr. Cole, do you do that with your family at all? Do you guys ever think of a warm-up? I mean, do you share it with that? You guys just go out full out?
Just go. I mean,
have you ever had a skiing injury?
Yeah, Well, so I had a really bad fall. So I was doing this adult ski thing where you go with Steve and Phil Mayer, who were Olympic champions. They're my age, and I'm not sure, they were both Olympic champions on U.S. ski team. So now they run this course they used to do out of Steamboat. Now they do it at Utah. So I'd go with a friend, and get what they do is these 3-day clinics, and then they video you, and then they'll ski with you. So they rotate through different groups. They basically teach you how to race and then break down skiing into the racing components.
Neat.
It's very good, especially if you start skiing very young, where you have bad habits, because skiing is taught very differently now. I mean, you haven't skied in how long?
16 years.
Yeah, it would be like you were skiing when it was like the GLS method, where your skis are like 30 centimeters long.
Right. What are they now?
A lot longer or
are
a lot
they?
wider. Yeah.
The short ones were fun.
Well, they're wider, so they're not as long. There was this transition for long, and now it's maybe head height, unless you're doing GS or something like that. So it's a lot easier now because technology makes it easier. But at any rate, I was going down with Steve Mayer on a very steep run and just had a yard sale, and I got a concussion. I cracked my helmet. So you were saying you haven't worn a helmet. You hardly ever see anyone ski now without a helmet.
Yeah, last time I skied, there were no helmets.
Yeah, so if had I not, when you crack your helmet, it's only meant to tolerate one significant fall. You're done. You got to get a new one.
Wow.
But if you're going to crack your helmet, can you imagine what it would have been like? Because my head went back on the slope. And I just,
was it icy?
Not horrible. We were just, I was just out of control, So, but to her point about prepping, I think there is, it's like any sport, you got to get your motor pads. I will say I ski to warm up. I don't go out and ski really hard to begin with or really fast, but 2 or 3 runs in, I'm usually going pretty hard. And it depends who you're skiing with, too, what sort of brings you up. We got to get you out there.
I know. I'm dying to go. I really am. We always go wide, with the Bulls season, being a Bulls announcer, we don't get any days off, as far as we have to do every game. So the only thing we see is the NBA All-Star break, which used to be just really 4, maybe 5 days, and we usually go warm just to get out of the Chicago winter. So time to go to Utah, go cold, and get some skiing, and I think the family would really enjoy that. Again, we're with Maria Kronk from Accelerated Rehab. Maria, before we let you go, anything going on big at Accelerated? Give us the website and other things you guys are working on since we have you here in studio.
Website is acceleratedrehab.com. So that'll give you tons of information. We have lots of specialty programs within Accelerated. At my center particularly, we are big into, we have 2 certified manual therapists. We have an ASTM specialist.
Which does what? What is that?
So it's using special tools to help break up soft tissue adhesions for chronic tendon disorders. And then I'm a sports certified specialist, so I'll take all athletes, any kind, any caliber. We love them all.
Good.
Sports certified specialist.
Yep.
What is that?
So I have my SCS. So it's through the American Physical Therapy Association. So I actually did a residency. So it expedited the process for me to sit for my board exam in sports.
And it certified. Like, what's the curriculum? What is it? What do they emphasize?
So you do it after you graduate, actually. So we have to be emergency first responders. We have to have so many hours in the clinic and on the field working with athletes.
Got it.
And then with doing my residency, I did that with Minnesota Sports Medicine, actually.
Oh, great.
So I was able to ski instruct when I lived up there. So
that's
that was
good.
pretty sweet.
Cold, but good.
Yeah, right, exactly. Lots of snow, though.
Yep.
Absolutely. Thanks so much, Maria, for joining us. Maria Kronk from Accelerated Rehab. We're going to go to a break. More Sports Medicine Weekly after this.
On ESPN Radio.
At ATI Physical Therapy, we're changing the way you think about physical therapy. We have just one goal at ATI, to make you feel better. And that's what we'll do. With the friendliest staff, the most vibrant clinics, and a unique treatment philosophy focused on making your time with us the highlight of your day. See how rewarding physical therapy can be. Visit ATIPT.com or stop in one of ATI's 80 Chicago area clinics. Taking physical therapy to a higher level, that's ATI. Get there.
We help gardeners keep gardening. We help runners keep running. We help golfers keep golfing. We help moms keep mothering. We help tennis players keep tennising. You get the point. At Athletico Physical Therapy and Occupational Therapy, we help people keep doing the things they love to do. So if you have an injury or a nagging pain that's holding you back, we can help. It can all start with a simple complimentary injury screening by a physical therapist or athletic trainer who will assess your strength, range of motion, and flexibility. Following your screening, we can make a recommendation and show you stretches or exercises to help you manage your symptoms and care for your condition so you can get back doing whatever it is you love to do. To schedule your complimentary injury screening, call 1-877-ATHLETICO or go to athletico.com.
You can listen to past shows of Sports Medicine Weekly by downloading Stitcher, and you can find Stitcher on our website. Click on the Stitcher logo and listen to Sports Medicine Weekly.
Remember when playing a round of golf or shooting hoops with your buddies didn't bother your knees? It's time to get back in the game without surgery or more pain pills. Ask your doctor about the Oser Unloader 1. It's an easy-to-wear knee brace that is clinically proven to improve mobility and decrease the need for pain medication. Try it out and feel the difference when you win again. To learn more, call 877-265-2005 or visit www.oser.com/knee pain. That's OSSUR.com/knee pain.
You're listening to Sports Medicine Weekly on ESPN1000.
Sports Medicine Weekly is being brought to you in part by ATI Physical Therapy for the highest quality care in a friendly environment. By Oser Americas, orthopedic technology for a life without limitations. By Integrated Orthopedics,